this is called framing, and we called it framing. And it's the influence of formulation on preference. And I think the example I like best is a study that I did not participate in. Amos did that with some colleagues from the Harvard Medical School of Public Health, where physicians and patients were asked about cures for lung cancer. And they were presented statistics for radiation therapy and for surgery. And one of the details is that, of course, if there is surgery, there is some mortality early on. I mean, people die at the operation or from complications. 10% of people, say, die within a month with surgery, and that doesn't happen with radiation. Now, surgery has a lot of long-term advantages. So they presented the statistics either in terms of how many people die, so they call that 10% mortality, or in terms of how many people survive. So it's 90% people survive 1 month, and it goes on to, I don't know, the 38% after 5 years or something. Now, 10% mortality and 90% survival are equivalent, they are synonymous, but they don't have the same impact. 10% mortality is much more frightening than 90% survival, and you get different preferences. So if you couch it as 10% mortality, people don't like the surgery quite as much. If you couch it as 90% survival, they're less afraid of it, and they're more inclined to accept it. And that applies to physicians at Harvard. I mean, this is universal, so that's a good example of framing.